New federal law could potentially save us thousands of dollars in the new year. Surprise medical bills will be banned in 2022. These are the types of bills that patients receive when doctors or other providers are not in the insurance network. What will and won't be covered, the answers are very complicated. So Chief Investigative Reporter Matt Campbell is going to walk us through what we need to know.
If you had a medical emergency and had to be rushed to the ER, would you know what's covered and what's not covered?
A lot of times what people don't realize is they think, oh, I have insurance, I'm covered.
That's the question Michael Urban from the School of Health Sciences at the University of New Haven often asks his classes.
We have so many different options in our insurance plans, it really gets confusing, and most people don't know what they have.
That can lead to confusion after procedures are done and expensive surprise bills arrive.
Thousands and thousands of dollars.
Urban is going to guide us through a common scenario that results in a surprise medical bill. He'll use a pre-planned surgery as an example.
You're going into a team where you're going to have an anesthesiologist, you're going to have the surgeon, nurses, other professionals that will work as part of that team.
Let's say the anesthesiologist is not in network, even though everyone else on that team is.
You get everything covered in network for whatever your plan is, but that one provider's submission for the cure that he or she delivered now is not part of that process of being in network, and so it gets treated by the hospital insurance companies as out of network.
In this case, the out-of-network provider would bill the patient's health plan. The remaining balance would get sent to the patient.
I have to pay that difference. I'm signing those papers. You know, all those forms you sign are saying that you agree to make payment on anything that's not covered by the insurance company.
Urban says this is a common example of how surprise bills get generated. The worst part is in many cases, the patient has no say and no knowledge until they get surprised by the bill.
I've gone for surgeries. I never get to say who my anesthesiologist will be, who will be this person. I don't get to pick the members. I get the doctor and the team schedules everything, right? So again, that's where a lot of people get these surprise bills.
Emergency situations where patients may not be conscious or childbirths resulting in C-sections are other examples of how surprise bills can pop up.
Hospitals and healthcare providers are not trying to do this to people. It's just sometimes it's, someone calls out sick, it's a case runs over and they have to do a last minute swap or change.
The surprise billing may not be intentional, but in the new year, it'll be banned in most situations. That's because Congress passed the bipartisan No Surprises Act. It reads, excessive out-of-pocket costs will be restricted and emergency services must continue to be covered without any prior authorization and regardless of whether or not a provider or facility is in network. Also, providers are required to let you know no less than 72 hours before a service is done if someone is out of network. It also covers emergency situations where providers won't have a 72-hour window to communicate the costs.
The bill does have provisions in there to allow for negotiations to go on to the provider to be reimbursed at the in-network rates.
These measures are meant to protect us from unexpected costly bills, but Connecticut passed similar legislation in 2016. But according to the Kaiser Family Foundation, our state is still one of the highest for per capita spending on healthcare.
So many loopholes in our legal system, the way how things are worded have been added on over the years, that there are still people in Connecticut that do get surprise bills. Since implementing the bill, though, that has dropped significantly.
Urban says some of the current loopholes revolve around insurance plan coverages.
Because of all the complexities of the different healthcare plans that we have, an insurance company saying that this plan doesn't fall under the state regulations. That's sort of how they've been working it.
In the new year, Urban says that excuse likely won't work.
Federally, this sort of closes any chance for loopholes moving forward here in the state.
For the most part, Connecticut patients are already protected through the state's bill, but we'll see this federal bill work for us, especially when we travel out of state.
Now, if you travel anywhere, that you're going to be covered by the same benefits that we have now here. The whole nation will get the same benefits going because it's at the federal level now.
This act will go into effect on January 1st, but experts warn we likely won't see actual change until at least June as everything still gets implemented. Also, there are legal challenges from the American Medical Association and the American Hospital Association that are still in court. Matt Campbell, Channel 13 News.